Hello from Nigeria. My name is Toyin. I'm the youth advocate who asked the Minister of Health about the government's commitments in 2020. Now I'm here to ask Dr. Salma, the Director of Family Health Department of the Federal Ministry of Health, what the government is doing to tackle inequity in this time of COVID, and how the government is supporting the health workforce during this time of COVID. This is what she has to say. Dr. Salma, how is the government tackling issues of inequity, especially gender inequity, in this time of COVID?
Thank you. As we all know, the federal government of Nigeria is committed to attainment of universal healthcare coverage, leaving no one behind. So to realize the vision, the federal government started implementation of the Basic Healthcare Provision Fund, which is aimed to address the issue of inequity in access to quality healthcare services, reaching majority of vulnerable people, particularly women and children. So this will be delivered through three pathways: strengthening the primary health care facilities in the country, and secondly, through the NHIS, that is the National Health Insurance Scheme pathway, that will serve as a safety net to ensure sustainable financing for services within the health sector. And another pathway that will also address the gaps is through the national emergency transport systems that will ensure that women have access promptly in a timely manner to healthcare delivery. So we hope by this we'll be able to address and reduce the high rate of maternal mortality in the country, as well as improve child survival. Yes, the health workforce we recognize is critical, though we recognize also the limitations that we have. So during the COVID pandemic, you have seen that we've all seen that the government prioritized access to the vaccines to the healthcare providers, especially the frontline workers. And we all know that majority of health workers in Nigeria, over 70%, are women. So this is still to show you that we are still addressing the gender gaps. So women have access to that. But most importantly is using the policies around tax sharing and tax shifting because of the limited number of human resources that we have. So women have learned a lot of skills, especially healthcare providers as the health facilities, to be able, using the policies of the tax sharing, tax shifting, being operationalized at the delivery level to enhance service delivery. And another way is also to continuous capacity building of our healthcare providers. Post-graduation, healthcare providers have various kind of capacity development manuals that have been developed, standard operation procedures, and this is on and on and on at all time to ensure that they are up to date with skills and capacities to be able to deliver quality services.
Once again, thank you so very much for your time, Ma. Would it be possible to return again in the future to continue this conversation and follow up on progress?
You're most welcome, Toyin. I look forward to engaging with you more and more as we work together to improve the well-being of women, children, adolescents in Nigeria. Thank you.
The government is paying special attention to tackling gender inequity, particularly in times of COVID, because a lot of unpleasant incidents arose during the lockdown, and there is a lot of collaboration between all the other ministries, especially Ministry of Women Affairs, National Primary Care Development Agency, and Department of Family Health works with all others who are in that sector and stakeholders to ensure there is equity, there's access to reproductive, maternal, neonatal, and child health, and nutrition. We are working in collaboration with those who are in charge of distribution of commodities for family planning, and also nutrition. As you know, nutrition is a very important part of the program. See, the Department of Family Health is doing a good job with its reach, in trying to increase reach and protect women from violence. Government is supporting healthcare workers, especially during this period, by making sure that salaries are paid in time, sending out infection prevention measures that are made compulsory in a way that all those who are supposed to get their salaries on time. The capacity building continues. People continue to have more training, and we ensure that when it's time for leave, people go on leave. And the connectivity between states and federal government with respect to training and task shifting and task sharing among health workers is being properly managed.